The most common way that a patient is injured in medical malpractice is that the anesthesiologist, people don't realize it, but anesthesiologists are not in the room a lot of times while a surgery is going on. And a lot of injuries occur because the anesthesia care is delegated to a person who's either not an anesthesiologist, or they're an anesthesiologist in training, or they're just an anesthesia assistant, or maybe a nurse that has as a certified registered nurse anesthetist that's not as qualified or as competent as an anesthesiologist. And when emergencies or situations arise, they may not have the background or the knowledge to deal with it. Another way that people are injured from anesthesia is just simply by inattention. People don't realize that this anesthesia is really the drugs are very potent, and they induce a state of it's not just sleep. People think of it as sleep, but your breathing is suppressed, your heart rate is suppressed, and it's very important that whoever's monitoring you monitors you very closely. And if people aren't paying attention to things like blood pressure, your pulse, how rapidly you're breathing, how deep you're breathing, the amount of oxygen in your blood, those things get overlooked and injuries can happen. That's why it's important to have an experienced medical malpractice lawyer, particularly somebody who's handled these types of cases, to kind of put together the puzzle of what happened during a procedure, because a lot of times these things aren't in the record.